Hey guys, how's everybody doing today? I'm Kelly Walla here at Westlake Dermatology, and I'm an aesthetic nurse specialist, and we are going to be talking about CoolSculpting and CoolTone and how to get our bodies back in shape after all this quarantine is lifted. So I hope everybody's having a great day. I'm going to be joined by one of our amazing dermatologists. Let everybody join and we'll start talking about CoolSculpting and CoolTone today. Hi!
Hi, Kelly. How are you?
Good to see you.
Oh, no,
How are
I
things
can't.
going?
Oh my gosh, I can't believe it's been 2 weeks since we've done this.
I
I'm
know.
excited.
So
I'm excited.
fun.
Good to see you again.
Good to see you. Now I know you're back and seeing derm patients in the office this week.
Yeah, so this was day 2 of being back in business, which is kind of crazy. So we're doing mostly medical dermatology this week, and it's been great. I mean, we're taking full precautions, so we're all having masks. We're doing social distancing. We're being very careful at check-in, check-out. We can text you from your car if you want. So so far things are going very smoothly, and it's good to be back. So
I'm sure your patients are so excited to see you. I'm sure they're like, oh my gosh. I mean,
I
just
know it's been fun.
it's just been great. I've gotten so, I'm sure you have too connected with your patients over the transition.
I know.
It's
It's
just
like our second family. It's just like we know so many of them so well. So it's good to see them, and it's just nice to be able to take care of them in person. So it's good.
right. And our coworkers. I miss my coworkers
I
too.
know. Yes.
I
Team
know.
Gordon. Oh, I was so happy to see them. So it's
I
fun.
know.
It's
It's
so
like,
great.
I mean, Westlake, we're our big family here. We have 14 locations, but everybody's just all together. We keep in touch. So we're glad that we're slowly coming back and taking precautions. I'll be back at the Westlake location doing cosmetics May 11th.
May
So
11th.
until then, we'll just keep doing what we're doing. So today,
Book now,
I
though.
know, book now. Book your appointment now for sure.
You know, Kelly, she gets busy real quick.
Yeah, we're all, everybody wants their Botox and their
I
fillers.
know.
And I saw somebody on here. I can't wait for my hydrofacial.
I
And
know, right? Yes.
and people want peels. They're like, this is the best time to peel because I'm wearing a mask.
We're all
So
wearing
it doesn't
masks.
really
A
matter.
lot of people are still, like quarantined for a while, so it's a good time to do it.
I know we come to work and it doesn't really matter because we're always peeling or doing injections or doing something. But now everybody's like, now I can totally do this because I am wearing a mask. And I'm like, perfect.
Perfect.
Let's
I
get your
know.
face going.
Well,
So we
speaking
are
of that, how are we all feeling coming out of quarantine? Do we have the COVID-10 going on or what?
I know, right? That's right. I know. A lot of people have been on quarantine. Some people are like eating more than others. It's definitely a different according to what people are wanting to do. So what have you been doing? I know I'm an exercise fiend. My stress reliever is to run and work out. What have you been doing?
I'm the same. So I'm an avid worker outer because I like to eat a lot. So
Yeah.
and it's such good de-stress. But it's hard because I know you liked Orange Theory too. Orange Theory's been closed, our gym's been closed. So we've turned our garage into like a makeshift workout place. And then it's been such nice weather. We can go out for runs, which has been awesome.
Oh,
So
I know. The weather, we have been really blessed. We're here in Austin, Texas. So a lot of you all that have joined us, Dr. Gordon and I are taking over Westlake's Instagram today, and we're going to be talking about CoolSculpting and CoolTone. So just we're getting our body out of quarantine and what we can work on. Dr. Gordon is our dermatologist at our South location, and I am the aesthetic nurse injector at our BK's location. We both have our own Instagram. She's living the derm, and I'm Kelly Walla Beauty Guru. But today we are doing Tuesday Takeover with Westlake Dermatology. So we are going to talk about the differences, and if you all have any questions, then just put them in the comments and we'll be able to answer. So let's talk about CoolSculpting first. Like, who's the candidate for that?
So CoolSculpting is awesome. So it is basically non-invasive permanent fat removal. So the way it works is it's kind of got a great background story. So back in derm residency, we learned about what was called popsicle paniculitis. So it's when a little kid would eat a popsicle and all of a sudden you'd see this atrophy of the fat in his cheeks. And so some very smart person turned this into technology. So when you freeze fat to a certain level, it actually makes it undergo suicide, basically. And so then your body reabsorbs that fat and it is permanently gone. So, CoolSculpting is designed to take any pinchable fat. So it's got to be fat that you can actually pinch. And what it does is it sucks that fat up into kind of a device, and we can show you what the tips look like in a little bit. And then it has cooling, and it's great because it's got a way to protect the skin, and it freezes it to a temperature that actually makes it undergo this, what we call apoptosis or suicide of the fat cell, and then your body just washes away that fat. So I usually say a good candidate is somebody that's got pinchable fat. A lot of us have those places that are just genetic pouches. We can't get rid of them, you know, and no matter how much we exercise. And some people, even if you don't exercise, you just want to get rid of it. So,
yes, I definitely think on this treatment, we customize our treatment because we have so many different tips, just like Dr. Gordon said. So when we customize the treatment, we make sure that all these different applicators, how it fits, because we can pretty much do like a lot of areas on the body. I mean, from the chin to the arms to the bra fat, upper and lower bra fat, the hips, the flanks, inner thighs, outer thighs.
Above the knees.
Above the knees.
That little axillary fat right there.
Yes, right there. We don't like that. I mean, there's lots of different areas. So I kind of say my slogan is, if you can pinch it, we can get it. Yes. So that is true. And you want to make sure it's subcutaneous fat. Most people don't know what that is if you're not in the medical field, but that subcutaneous fat is the squishy fat, the fat you can actually pinch and pull away from your body. Now, when some people come to us and they actually need really more contouring and reshaping and have a lot more fat removal, then at that time, we would probably suggest them to do a liposuction, correct?
Yeah, so liposuction is kind of a different beast where it's more obviously an invasive way to get fat out. So we actually poke little holes into the skin and use cannulas to suck out the fat. It's great though because we can do it now in settings where you don't need general anesthesia. We do what's called Tumescent Liposuction, and so that can give us more of I don't want to say like some areas where you can kind of reach more than a CoolSculpting tip can fit. So the only downside in CoolSculpting is you have to kind of adjust the tips to where you want it, and whereas liposuction go in most places, but there's very few times where we haven't been able to CoolSculpt something.
Oh yeah, we will manipulate, move your body around to get there.
You may have to stay in a really weird position for a little while, but
that is so true. So yeah, is there a certain area of the body that you see has consistency best results?
Oh gosh. They're really good. What's your favorite?
Yeah, I mean, what first came out was first FDA approved, and it was actually in 10 years ago, in 2010 for the flanks. And then it went to the abdomen. So I really feel like a lot, I mean, pretty much all the areas we're going to get the best result. I know we see a lot, but I think it's people that really have the underlying here they don't like, under the arm, the abdomen, the stomach is great. Now people have the upper fat, the lower fat. Someone said I have a little lower belly pooch, nothing crazy, but definitely round out. It actually can really help that contour that area and keep it really nice. So I think the abdomen is probably something we treat a lot. Is that probably more?
Oh, abdomen probably number one. I think the fluffier the fat, so the more just kind of squishy pinchy it is, the better it responds to this. Yeah. And so you get a lot of that on the abdomen. The inner thighs you get really good response to. And like it's harder to, and I think this is one thing we should bring up is like, especially in the flanks and kind of like the back area, a lot of times you kind of have to double up that treatment to be able to see as good of a result as on the like fluffier belly fat. So it's something to keep in mind if you are wanting to do your flanks and sometimes your bra back, that's more what we call kind of fibrous fat. And so it's harder to get as much removal of that fat with just one session. So a lot of times we do what's called double stacking. And there's a lot of different ways to do it. And it kind of is provider and patient dependent, I feel like, but sometimes we do it same day. So we'll do flank, 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 if they're up for it. And then other times we'll say, here's one round, do it again in a month, or other people say, hey, do around, let's give it the full 3 months, see what it's going to do, and then do another one if they want. So
right. So that was one of the questions. Does it take multiple treatments? It does take multiple treatments if you have some more areas that have more excess fat. Each treatment in the clinical studies showed that it was a 20% reduction. And then we do stack the treatment within 30 days. Some people like to do it, like you said, Dr. Gordon will do it sometimes on patients, and I have to immediately right after to give it that boost. But you will have some swelling after each treatment. So you kind of want to wait till that swelling kind of goes down and kind of see the results. I think the maximum results is about 90 days, but at 45 days, you can see a really good result at 45 days.
Yeah, I've got a lot of people, and you may see this too. I feel like there's some people that are just really good responders to it, and others that maybe aren't quite as good or just delayed responders a little bit.
Yeah,
and it can come from if you're, gaining weight during that period too. But a lot of people, I would say most people see it at 45 to 90 days. Some see it as early as a month. And then I have some that honestly it can take 4 or 5 months to sometimes see. So it's kind of interesting.
Oh, yeah.
Some delayed ones, but I would agree. The majority of people, 90 days, you're like, boom, this is where you're going to be. Do we need to do anything else? So
I have my patients come in and I customize the shaping on how we're going to contour with the CoolSculpting. And we have all these different adapters and these different plates because our fat, none of our fat, it doesn't really lie the same way. I mean, we kind of have, like someone on here said they have lower abdomen fat. Some people, their fat lies differently, even like post-baby, post-pregnancy, maybe have some more in the upper abdomen area. So there's all these different applicators that we fit on you, and we have a measuring device that we can use, a template that we use in order to see which one is best for you. And someone did ask on here about swelling. What do you say to your patients how much swelling they have?
So totally depends on the area. I do think that like pinchy fat swells a little bit more than other fat. So a lot of times the belly's worse swelling than some other places. And it can last sometimes up to a couple weeks. So I would plan at least that long for swelling if we've got a vacation planned or something like that. But I mean, after that swelling, if you get it, nobody knows anything happened. So, I mean, your secret can be safe if you want it to be. So
that's right. You can hide your secrets.
That's what's so great about this treatment.
I know. It's easy. I have people that'll come in and they'll be on conference calls and they're getting their CoolSculpting, or they're doing their work, whatever work it is, if they're reading their documents and whatever they have to do for the work. We just set everything up on a tray table and they'll have their computer and all their stuff there, their phones, and they just go about their business. You just probably want to turn off the video monitor on your
neck up if you're not doing your chin. As long as you're
That's
not
right.
doing
That's right. That's so true.
So what would you say during the procedure? What do you think? What do you say it's like?
I feel that the first part, the suction part, is if you haven't had that like pinchy, anybody's ever pinched you before, pretty hard. My brother used to do those little froggers when I was a kid, and that was not fun. It's pinching pretty hard. So that suction part, and after the suction parts, and then it starts getting cold within that first 10 minutes, I think it's fine. It's absolutely fine. I think the more stretch you have, the easier it is. The people that complain are people that are really tense and tight and really don't have a lot of fat. They may feel more of a tingling sensation until that 10 minutes is up. And after the 10 minutes, then the area that's in the adapter is frozen. And so it's numb at that time. Now, all those nerves and everything comes back. It's not a permanent thing.
Yeah, sounds scary.
Not worry about scary. And we actually put a gel pad over top of the skin and a protective barrier before we do this. So there's no issues with your skin having any kind of problems by doing this procedure. But that's what most people explain to me. And it's after when we take it off, we have to do the massage. They don't really like the massage.
Massage is usually the part that we just tell them to grin and bear it. But it's the most important part. So that's what I tell people. I was like, look, if you went through this whole thing, you can get through the 2 minutes of massage. It's where you really break up those fat crystals, and it can make a big difference how good your results are. So yeah, I agree. I tell people, look, it's going to get so cold that you're to the point where you're like, I don't know if I can do this. and then it just goes numb and you're like, I can do this.
That's right.
Sit there for your treatment, which is most of the time about 35 minutes. There's a few other tips that are a little bit different. But most of the time, each tip is about 35 minutes. And then you've got a 2-minute massage afterwards. So you can get multiple tips done in a day with us. And that's what we often do. So usually, you know, if you're doing kind of that donut around your abdomen, we'll do, you know, kind of a tip, a diamond shaped tip, kind of to get it all the way around. And so a lot of times that'll be like, you know, 4 tips in a day, but it gives a great result. So like Kelly said, it's all customized to what you know, what your fat looks like and where you want it and what you want to accomplish. So
yeah, so that's why we do our consults and have you come in and we'll kind of feel around and we'll kind of talk to you about what you're trying to achieve. And some people that come in are, you know, trying to get a head start. Like when they come out of quarantine, they're like, maybe I've been eating a little too much, so I need to get on a head start to get into later on in life and the clothes I want to wear or the clothes I used to wear. Thank God we wear scrubs.
right? Love them.
Right? But I want to talk about the different areas. So this is the applicator for the chin. And the chin, we can actually take care of this submental fat here. And some people have it on both sides, this way and this way. So we will actually overlap 50% in the middle and we'll do both sides. But the chin has been a great response. You're red under here for maybe 20 minutes. But other than that, the redness goes away. And then the swelling's there for maybe about 24 hours. I don't feel like the swelling's that bad in the face. Yeah, what do you think about this?
I agree. The chin is great. And because what I really like too, especially if you do what Kelly talked about, the side and the side, is that you all of a sudden get this really great defined jawline, because I don't think we realize that we all have that little pinchy fat right there.
Yeah.
And that's one of my favorite results, is when you can really just all of a sudden see this little sculpted jawline.
Like on
it's great.
Of the jawline here.
Yeah.
Awesome. Another great one, especially because summer's coming up and everybody's gonna be wearing tank tops, is on the arm. Like doing this area right here on the arm. We use this flat applicator and we can put that under here. So when you're wearing your tank tops and you know, all that, you're wanting to get everything nice and toned under there. You want to get that fat off. So to do that, this is where we put that applicator right there. And I really like that.
I love it.
Now another good one is right here again when you're wearing the tank top. You could use the mini. What do you think? Do you use that a lot?
Oh, I love that. The mini is wonderful right there. We stick it right there. And also sometimes we'll get it right above the knee for that wonderful little hangover fat that we all have.
Yeah.
So yeah, that little mini applicator is, you know, lots of good places you can stick that guy.
Yeah, we have so many different sizes of applicators and where they can fit. And we'll turn you sideways and pull some fat out and put that on. We will, like I said, if you can pinch it, then we can get it. There's no doubt about that. With all
we may have to strap you in it, but that's okay.
Right, and we'll strap it on it. We'll make sure you're all comfy and reading your magazine or book or doing your work. Or most people bring their Netflix in and they're like, I want to watch a movie that I don't have time to watch because my kids or my husband's always around or somebody's always bothering me. So it's kind of nice to have my hour or 35 minutes in here of peaceful time, which is nice. So that's good. So we also have larger areas too that we can treat. And this is called the Cool Max. Now, where would you use this on somebody?
This is awesome. So I always say, if you can get this on somebody, it is worth doing it because it's like doing a double treatment. That thing is amazing. And the majority of places that I use that is lower abdomen for slightly larger people. You know, sometimes you can get it on upper abdomen and very rarely can you get it on the flanks, but if you can get it on, it's totally worth using that guy.
Yeah, so this is definitely a great treatment area because you can get a lot of fat in this applicator at one time. You just have to manipulate and move it around so we can actually put on the patient. So when you come into the office, I always have everybody kind of tell us our troubled area. This is kind of how we do the consultation. And then we'll measure you. So we use these measuring guides. We have this one, and then we have the Cool Max, and then we have the chin. So we'll use all these different measuring guides, and then we'll make your template kind of like your your plan, your treatment plan for your CoolSculpt so that we can get all the areas done for you.
Yeah.
Now, do you have the patients wear something? How do you have them come into the office, and how do you have them leave?
Oh, good question. So I usually say just wear something comfy, and also wear something, if it gets a little goop on it, you're not going to be super mad about it. We have things for you to change into while you're in the office with us. So don't worry about that. But when we clean you up once you leave, but if you're like, no, I want to, keep my own underwear on, or I want to keep my own pants or shirts on, whatever, during this, just might get a little bit of kind of that goopy stuff that we talked about earlier on it. But be comfy. I mean, you can wear anything you want. You may be a little bit sore when you're leaving, so you kind of almost feel like you had the deepest massage of your life after you leave. But and you're numb after you leave. And we'll talk about kind of what to expect afterwards. But I say be comfy for the most part. But there's really no restrictions. That's the best part about CoolSculpting, is that if you felt like it, you could just go for a run right after you left our office. That's fine.
Yeah, there are no restrictions, which is great, which means no downtime. So this is the treatment to get rid of your fat that you don't want anymore and not have any downtime and not have anybody notice. I mean, right. There you go. What else can you do?
What else do you need? Yeah.
That's
all
all
you
need.
see bruising, Kelly?
So I don't really see bruising much unless somebody is super tiny and just is, has a little bit of fat and they just really don't want that area. They don't want that fat in that area anymore. Then if their skin needs to be pulled more into these applicators, and we have the smaller ones that we'll use. We even have the petite, the little baby ones. So we've got we've got different ones that we can use. So if that's the case, then we can pop this on and get those smaller areas, and then we can do this area too. So I don't really see bruising much on my patients, but I do have them dressed comfortable, come in, be relaxed. Watch a Netflix or check up on your emails, or people online getting all their online
people
stuff done.
Order food to the office.
No, I have not had to do it.
I've had patients that they just order some food while they're there. It's fine with me.
I have patients that'll actually have their Starbucks or their juice land here with them, or they'll eat their protein bar or something. Yeah. But they try to get in and get out. I mean, I have a couple people that'll come up here and want to be on the machine all day, which is great because they're like, this is my alone time. I'm just going to come and set up shop and get all this done. And it's great because you can see the results, pretty fast without any downtime, like we said. And I do have the patients kind of wear some kind of a compression, like a tight workout pants or something afterwards. Yeah. What do you say about that? I feel like it helps
good call. I think compression, I don't think there's any necessarily, it makes you, makes your long-term results any different, but I do think it just feels a lot better on. It's really weird after you have this done because you're numb in that area, and you're numb for up to a few weeks, and like then if you do something active, sometimes you feel like there's just this numb brick like moving around, and it kind of feels funny. And so so I feel like the compression kind of helps you feel better, and then if you do have the swelling, it kind of helps mediate that quite a bit too. So there is something about compression that I think feels really good after any kind of body contouring.
Yes, I definitely agree with that. So let's talk about those patients that don't really have excess fat anymore. They actually just want to tone their muscle and, get those six packs to show again. So what will we do
about CoolTone?
I know. We're so excited that we have the CoolTone, and this is the actual hand paddle. I'm actually here at the office today, even though I haven't started seeing patients till May 11th, but this is our CoolTone, and I love this machine. This is awesome. It is literally tightening your abs while the machine's on here, while you're sitting there in the chair. So why don't you talk a little bit about it, and I'll show some photos here.
Nice. Yeah, so CoolTone's it's one of the newest devices that's out, and it uses kind of like what they call MMS. It's a magnetic
muscle stimulation.
Thanks, Cal. It avoids the skin and the fat because they don't actually resonate as well with the magnet. So it can get to, with the fat. So it can get to the muscle layer much easier. and it stimulates the fibers to produce contractions at a crazy rate. So it's almost like you're doing 20,000 sit-ups in one session of the CoolTone on your abdomen. And so how often do you tell them to do treatments? How far apart?
Well, you can do the CoolTone, you can do it twice a week. And I have had some patients that want to come in like Monday, Wednesday, Friday, Monday, Wednesday, Friday. It's a lot like going to the gym. I mean, if you're going to work out and you're going to commit to doing it, and once you start, you put this on and you're feeling the machine stimulation, it's like you're doing those sit-ups. Now, you can do this on the abdomen, you can do it on the front of your thighs, and you can do it on the buttocks. So those areas we're all toning. And it's amazing the results, because the patients are like, wow, even after they finish it, they feel like they just got done with the gym. They just feel like they just finished doing their sit-ups or their squats, which is great. And the results, most people do anywhere from 4 to 6 treatments, and then they'll come back for a maintenance once a quarter. So here I'll show you kind of, this is the company's results, because we actually just got the machine. We haven't had it that long until we kind of went on our little quarantine. So we're excited to get everybody back in so that you all can get your treatments done. But you can see here, here's a before and after of an abdomen.
Oh yeah, so everyone knows they're flipped because of the screens on here.
Yeah, you can see underneath it before and after. But the people that have done it, and I've done it myself, it's really a great treatment. And there's no pain involved at all. So it does not hurt. Some people that don't work out a lot will feel like, wow, I just, like, somebody's like a little more stimulation, but we actually increase it according to how you handle it. Just like if you're at the gym and I'm your trainer and I'm like, okay, we're going to do squats with a 20-pound weight. And then you're like, oh, this is easy. Then I will turn the machine up and be like, okay, now we're going to go to 40 pound. And then we're going to go to 50 pound.
So you're the personal trainer of CoolTone.
I'm the personal trainer on the CoolTone. That's how it works.
So are you sore like a hard workout for the next couple of days or not really?
So some people that don't work out on a daily basis, they are sore. They feel the soreness like they had when they did go to the gym and work out. Like they've done a lot of squats and they had actually done a lot of sit-ups. So that is what people feel. But some people that work out a lot, they are not sore and they are like, wow, this is kind of like cheating. I kind of like it. I know, right? This is great.
Now, who can't do CoolTone? So because it's magnet, do you have to be careful with metal or like IUDs or anything like that?
Yeah, so actually just pacemakers, defibrillators, those kind of devices for cardiac patients cannot do those. And we don't put it over any kind of magnetic implant of any kind. So when we're just treating the abdomen, the front of the thighs and the buttocks. Now, this company is also the one that I'm pretty sure they're probably going to come out with more, because this is also the company that owns CoolSculpting. So, you know, when CoolSculpting came out, they just had one type of applicator. And then CoolTone, we just have one size paddle. We actually have 2 paddles, and this is the paddle, and we have 2. So if we can put this on, you know, both sides of your buttocks or your thighs, I have a feeling that they're going to come out with more sizes, and we're going to be able to do more areas, which is going to be great for our patients. You know, just like with CoolSculpting, you know, they went from the applicator to the smaller, to the petite, and then to the mini, so that we can fit, because we're not all the same shape or size, or it'd actually be pretty boring. So we're all different sizes and shapes. And so that's why we have, you know, the ability to do this.
I love it.
But the one thing I did want to say is that you want to make sure that if you have excess fat, that we're going to treat you with CoolSculpting first, and then we'll treat you with the CoolTone to actually tone those muscles. So you want to get rid of the fat in the area that you want to treat before before we start tightening and toning the muscle.
I was just going to ask, I'm coming out of quarantine and I need everything you can give me. So CoolSculpt first.
I know.
After. I love it.
I know, this quarantine, we're kind of quarantined. So what do you all need out there? Let us know.
Let us know. What's everybody need?
Yeah,
throw us
what
some
do we
questions.
need? Yeah, give us some questions. We've already talked about, so if you're doing CoolSculpting and then CoolTone, you'll want to wait a month after your CoolSculpting treatment before you do your CoolTone. We talked about the consult. You'll come in for a consult for the CoolSculpting, but you don't necessarily have to come in for a consult for CoolTone. If you want to tone the muscles and you don't have any kind of metal implantation device, then we can do, and right now the areas we can treat is your abdomen, the front of your thighs, and your buttocks. But other than that, and if you're not a candidate for CoolSculpt, then we can get you to see our Dr. Gordon for liposuction. So
Yeah,
patient asked, can you cool sculpt a chin, and then can you cool tone for chin? So that would be awesome. You can cool sculpt the chin, and we did talk about that, under here, the neck area, right here. You can do that, and sometimes the fat is either centralized or it's on each side. At this point, you cannot cool tone your neck, but you can actually cool sculpt to take the fat out. And we both do this treatment and we think it's great. You can do
fantastic.
Yeah. And this one takes 45 minutes. So this is a 45-minute tip that we'll be doing when you do that.
Yeah. Another question I get a bunch is, after CoolSculpting, well, am I just gonna, because it's permanent fat loss in that area, so that fat is gone, am I gonna just gain fat somewhere else? So what do you tell people with that?
Mm-hmm. I tell people, if you gain over 25 to 30 pounds, then your fat cells have got to go somewhere. So right. You will gain fat. We're born with the amount of fat cells that we have. So only way we get more fat is we actually implode the fat cell by, the increase of adipose and tissue and everything. So we'll implode the fat cell that we already have. We're not getting new fat cells. We're actually making it kind of like a balloon. You're blowing that area up. So yeah. I don't think, unless you gain a significant amount of weight, that you're actually going to get fat anywhere else. And I haven't seen that. And we've been doing this for 10 years, since 2010 when it came out. So have you seen any?
You do gain weight. If you think about it, well, you have fewer fat cells in that area that you treated. So you may notice it other places first, but your body's not going to just, say, what'd you do to me? You took away some of my fat cells. Now I'm going to build some other places. So unless you're gaining weight, you're not going to notice weight gain other places.
And we have someone on here that said that she treated her chin with the CoolSculpting under the neck area, and she said that she almost fell asleep, which some people do and they come and catch up on their rest. They're like, hey, nobody's bothering me. I get this room by myself. I could just hang out and sleep, and everybody leave me alone. So some people do rest while they're here, while they're getting it. It is true. It is true.
That's great.
So
we talk about outer thighs, those saddlebags. A lot of people talk about those. And that actually is a place, even though it's not quite as pinchable like we were talking about, it's actually a wonderful place to do CoolSculpting. We use a slightly different panel. We use a flat panel for that area. And it just sets on really tightly. So that one doesn't actually have that vacuum suction to it. But you still feel the cold. But if, we're trained how to put it on correctly so it can get that saddlebag really nicely. And it just, makes you from this to just the single bubble, and then kind of nicely does.
Right. It contours that outer thigh so nice that you can, maybe most people do it because they want to look better in their clothes. They really like the treatment. I think since that area is a fibrous, I tend to do that area twice on most patients because it's fibrous.
Yeah, oftentimes you do. Yeah, agreed. And then banana roll is another fun one.
Yes, the banana roll. Woo!
The banana roll is that area right underneath the buttocks that just makes its own little banana there. And so it's a really nice place to get an applicator right on. And
we can do that, the banana roll. We usually use this tip right here, because we just suction that right on underneath the buttocks and take that excess fat out. Like I said, when you do this treatment, the first treatment is 20% reduction. If you do the second one within a month, it's a 25% reduction. So depending on how your fat lies, that's why we've got all these different size tips, which is great.
Yeah, we will get it on you.
So we can contour the whole leg. We can contour the outer thigh. We can contour the buttocks, and then you can actually come in and do your CoolTone and lift and tone your butt. So there you go.
We've got a plan. We have a post-quarantine plan now. I love it. So, Kelly mentioned, liposuction. A lot of people ask, well, what's the difference between, CoolSculpting and liposuction? And, we briefly talked about this at the beginning, but liposuction is where we're doing invasive fat removal. And so we do a tumescent technique. We put lidocaine, saline bags with lidocaine into the fat compartments, and then we actually make holes into your skin and we suck the fat out. So both are permanent fat losses. So you can sometimes get areas that you can't reach with CoolSculpting with liposuction, and you can sometimes do more areas. And if it is more like slight contouring and that kind of thing, then liposuction is a great option for you. But you do, undergo this healing process where you're draining, and in compression, you have some delayed swelling. You definitely have bruising with that one. But it's very safe. It's a wonderful technique. And so sometimes if there are a lot of areas and you just don't know if you can go through that many tips of CoolSculpting, then liposuction is an outstanding choice. So definitely another option post-quarantine if anybody's interested.
That's right, post-quarantine. We'll get our bodies back together.
Do that, and then CoolTone after your liposuction.
Right, that's right.
Perfect. Let's see. When are consults at? So we can do virtual consults right now at any time. It's probably easiest to do them in person because we can actually put the applicators on you and mark and figure out how many tips you need. I know Kelly said she's going to be back on the 11th, right?
Yeah, May 11th. We'll be back.
And then our consultants, are also back the 11th, right?
I think some of our consultants are back this week.
Oh, they're back. Yeah.
Yes, I think they're back this week in different locations.
Make an appointment now.
Just call. You can call. We've got people here to answer the phones at all the time, and we can get you into any of our locations wherever you are. We'll figure it out. I know this COVID-19 and this quarantine, everybody's itching, getting crazy, wanting to get out. And yes. I've had so many people say they've got a laundry list of stuff they want to get done and get all their things done. So I think that's important that people get their planning done. And so then you know what your laundry list of things is that you want done. So when you come in and do your consult with any of us, then we can kind of prioritize that and see what's best for you and your treatment protocols and everything else that we can help you with.
Dr. G just asked a great question about products post CoolSculpting. Mm-hmm. What do you like?
So I like the Transform, and it's out the door. I should have brought that in here, but it's by Elastin, and I'm honed in on clinical studies. I mean, this whole quarantine, I've been doing so much studying. I feel like I'm back in school. I mean, my daughter's in school all day. My husband's on meetings. I work out super early because I don't sleep. And then I'm studying all day long. My daughter's like, "Are you in anatomy class again?" I was like, I think so. That's all I'm doing is studying. So I really like the clinical studies, and I like the clinical studies that actually compare apples to apples and oranges to oranges. And so the clinical study that Elastin put out with Transform was actually comparing patients post CoolSculpting. And the product that we put on, we actually put it on you here, and then you can get it to take home. It actually is a macrophage, which is kind of like a little too scientific, but it actually eats up the fat cells and helps your results faster. So you'll start seeing results because that whole destruction of fat cells is about the first 72 hours. So once we put this product on and we're massaging that area, like we said that we have to do right afterwards, and you'll continue to do that at home, it really helps break down those fat and clean out all those fat cells so that you can have a nice contoured shape when it's all said and done.
Yeah,
so I love to do that.
I love that Elastin product. I also love Revision's new Body Firm, which I think is also great for the skin post procedure. I think both of those are awesome. NeoCutis always has great post procedure. Their body just moisturizer too for any kind of skin issues is fantastic. But between the Elastin and the Body Firm, I think you can't go wrong.
So someone on here is asking, any specials for services coming out of quarantine? Well, it actually is. It's our event month.
It's event.
Yay! It just so happened that we're opening on May 11th, which is event week, and we've kind of, since we have to do these precautions and safety measures, because we're doing safety measures for ourselves as long as with all of our patients, so we're staggering it out. So we're actually going to make it the whole month of May. So we'll have our specials the whole month. So everybody will be able to get in, and we won't all try to cram in within 1 week because we have to abide by our governor's laws and the CDC and Texas Medical Board and all those things. So we are taking all that into precaution, but we're definitely going to have all the specials when we get out of this quarantine. And we are seeing medical patients now. So all of our offices are seeing medical patients, and Dr. Gordon's patients are so excited because she started back yesterday, right?
Yes.
Yeah.
Great. It's been so good to see my patients.
So it's been great that she's seen her patients. And then cosmetic procedures and plastic procedures will start on May 11th. So we'll be able to come and see. But we do have our consultants, and we have our call center answering calls. And
yes, get on the books now.
Yeah,
Floodgates are going to open.
Definitely get on the books, because we've got people like lined up with their laundry list. Get on our website, figure out what procedures you're interested in or have questions about, and you can always get in with a consultant. We're doing virtual consults, and we can always help you with any of those questions that you may have. Anything else you want to add today?
I don't know. Let's see. Let's look at my list. I think we got everything.
Someone says, I'm on the books for multiple occasions.
Yay!
I know. I told my husband, I said, as soon as this quarantine is out, I will not be home for 6 weeks. Bye-bye. I got to go somewhere to see somebody, to visit somebody, to do something.
I love it. I love it. But we're here. We're going to be safe. We're going to see you guys as safely as possible. And if you guys ever have any questions or need anything, call us from the parking lot, anything like that. So we're here for y'all.
Yeah, we definitely are. So we'll just re-wrap really quick. We'll wrap up, we'll summarize. So we talked about CoolSculpting, and we talked about all the different areas. It is permanent fat reduction. And this treatment, it can be done in the office, at any of our offices, and it takes about 35 minutes per tip. Some are 45 minutes. If you can pinch the fat and pull it away from your body, if you can pinch it, we can get it. So we'll have you come in to get a customized treatment plan so that we can figure out how many tips and how long you need to be here. So we do like to do that. The CoolTone is our latest and greatest. It's our tone in all of our abs and our buttocks and our thighs. So this treatment will tone everything after you get rid of. So if you've been working out and you just want your six-pack and want to tone that back up, then come in and we can do the CoolTone. We normally do 2 treatments a week, anywhere from 4 to 6 treatments. And then you just do it once a quarter, kind of like going back to the gym. So as much as you want to kind of increase that area, but the results are amazing. They do last. And then if you're a candidate for more shaping that the CoolSculpting can't do, and you need to take out more fat in a certain area, then we also have liposuction.
Absolutely.
So you've got 3 options. You've got all
3
these
wonderful options.
Woohoo! You got lots of options. I know. So we are taking all the precautions. We're being safe. Our patients are going to be safe. We cannot wait to see everybody. Thanks, Dr. Gordon, for joining me today.
Thank you, Kelly.
This is awesome. Have a great day, everybody.
I know your patients can't wait to see you. So hopefully we'll see everybody soon. Be safe.
Bye-bye. Be safe.
Bye.